Hi everyone, welcome back to the channel. I'm Drew. Let's talk something. And oh boy, this morning I woke up around 10:30. I looked out the window and it was like a ghost town. It was like watching one of those Wild Wild West movie when the bad guys is coming through town and everybody runs indoors and all you see is the hay rolling down, being blown by rolling down the street, being blown away by the wind. It was almost like that. Usually around that time, you already seeing delivery trucks. You already see a few post office trucks. You see the FedEx trucks. You see a couple of UPS trucks. You see Fresh Direct. You see all of these delivery trucks on my block. I woke up this morning, looked out the window, and saw nothing. Nothing was out there. Barely anyone even walking in the streets. And I'm not a guy that worries. I'm not a warrior, kind of a worrying type of guy. But when I looked out the window and saw hardly anyone that's out there, I became just a bit worried, but not for myself, for my kids. Never have I ever witnessed anything like this in my lifetime until now. I've heard of the era of the Spanish flu, but I've never witnessed anything like this in my lifetime. I hugged my kids and told them I love them. I do that anyways on a daily basis. But this time when I said it, I actually worried. I was actually worried for the first time in a very long time. Everything everything life as we know it has actually changed in a matter of weeks. Weeks over this outbreak. And I don't know when it's going to get better. I just don't know when it's going to get better. Even my girl is worried. She's stressed out. It's hard for her to sleep. And then she works at a hospital. So in that hospital, there is a few cases. I forgot how many, but there are a number of cases in the hospital that she works in. And even though she doesn't work directly with patients, she does work with doctors who see patients. So she is kind of worried about that, about bringing home this outbreak to us. So now I'm going to read. This is from the New York Post. There are now 950 confirmed coronavirus cases in New York State, along with a total of seven deaths. Governor Andrew Cuomo announced Monday, citing new totals from the state health department. There are 221 new cases statewide since Sunday, 463 total cases in New York City, a jump of 134 from the day before. So yesterday, Sunday, there was only 134 cases. They have now 463 in the city. And I don't get why they just don't say the state or what this. I don't, they always talk about the city, and it's confusing to me when they say city because sometimes when they talk about the city, they're talking just about Manhattan, and then there are times where they're talking about the five boroughs. So it's confusing to me. There are now 220 cases in Westchester County, 109 in Nassau County, 63 in Suffolk County, 16 in Rockland County, and 12 in Albany County. Of the 950, 158 cases have been admitted to hospitals. The state has tested roughly 7,000 people, Cuomo said. New drive-through testing sites will be set up in the state in Staten Island and Rockland County, following an announcement Sunday that Long Island will also get its own facility. Westchester County, city of New Rochelle, now known for having the highest cluster of cases in the country, already has its own site. Cuomo also blamed the federal government failure to institute nationwide disease guidance. All gyms, movie theaters, and casinos will be closed until further notice. Only facilities deemed essential will remain open, including grocery stores, gas stations, pharmacies, and medical facilities. I've mentioned this on my previous on my before on another video that it's funny how the CDC and other health departments, governors, mayors have been saying stay away from social engagements. Keep it low. Don't be around a lot of people. And it's funny how certain people is not doing that. Now they have to actually go ahead and put and basically pass rules or something or legislation, whatever it is, just to keep people from doing that because there's still people filling up bars and restaurants in certain places. Some people just don't. They're like me. They're not a warrior, and they're not people that worry, and they're just you know they're just like, hey, whatever it is, I'm living my life, and it's this is going to affect WWE. I know Vince McMahon is not happy because I know he was planning on still going ahead with WrestleMania. I don't know what he's waiting on to pull the plug. Up to now, he hasn't pulled the plug, and he's gonna have to, or I guess he's just gonna wait for the governor of Tampa to actually go ahead and pull the plug. But right now, there's a federal ruling that no gathering of 50 or more is allowed. So unless you're planning to have 49 people in attendance at WrestleMania, what's supposed to be your Super Bowl of wrestling, it's not. I don't think it's gonna happen. But from the rumors are, it's an insurance thing. But let's see how it plays out, especially with the UFC and Dana White saying the show will continue. And so a lot of these rich guys are just thinking about the money. That's it, and they're not the ones being hurt the most. The ones being hurt the most is the little guys, those mom and pop shops, those restaurants, those family owned restaurants, people that don't have the millions of dollars and the billions of dollars. Those are the ones that are being affected the most. And the big guys are still going to continue to go ahead and do what they want to do. And the small guys are the ones that are being forced to shut down unless they're doing deliveries. So only food service restaurants that are doing deliveries are allowed to work. Following Sunday's announcement, the downstate schools will be closed. Cuomo added New York City, Nassau, Suffolk, Westchester, and Rockland counties must have educational and meal programs in place by midnight and approved by the state. Cuomo is also planning closing all schools across the state but needs to go over details with state education department. That's after Mayor Bill de Blasio ordered city schools closed on Sunday. So everybody know by now schools are closed. My son's school was already decided. They already closed the school before the mayor uh, went ahead and called for schools to be closed. When he came home from school on Friday, he had a letter in his bag that stated that they was going to close the schools down for 2 weeks, uh, because of over 400 kids were absent every single day. So that prompted them to just go ahead and shut the school down for 2 weeks. But when on Sunday, after the mayor made his speech, I received a phone call from the school stating that schools will be closed until at least April 20th, until after the as they call it, the spring recess, or as I call it, the Easter break. Some schools, uh, the mayor's hands was basically the mayor was basically forced to make that decision because of a growing number of backlash, and teachers were planning on doing a walk. I'm sorry, a call out. They were planning on calling out of work sick as long as possible. They had meetings with their unions, and that's what they were planning to do. So the mayor's hands was basically tied, and with the growing number of cases, I believe it's the right decision. How long that decision should go on for? Maybe it should be for the rest of the school year, because when they go back to school on April 20th, uh, this virus is still out there. It will still be out there. By the time then, it'll probably be 3,000 by then. Who knows? And as the article I read before that says we should all assume that we have come into contact with this virus, and maybe that's what we should do. We should all just assume it because we don't know, because there's some people who are not showing symptoms. I watched an interview with a disease specialist saying that, and he's saying that you can actually breathe this thing in. You don't have to actually touch anyone or a surface to even get it. He said he has data. Him and him. He's wherever he works at, they have the data to back that up. That that you don't even have to physically touch someone or something to get it. Just, I guess, being in that 6 feet range, you can actually breathe it in if somebody has it. Some people can be carriers and not be showing the symptoms. They could be carriers, and this is and I've heard that before. I've heard the CDC said that before, and they said that they don't even know if that is even possible. This is very new, and this is something, this is just theories, and they were not sure. But this guy was saying that that's how it happens. Dr. Oz, on the other hand, says something completely different, and every specialist, every doctor they bring, not disease specialists, but doctors and surgeons that they are bringing on these news stations are saying all different things, adding to the confusion, adding to the chaos, adding to the crisis. As I said before, the media is causing this mass hysteria because they are constantly, and everybody just want the ratings. Even in a time like this, ratings is the most important thing in the media. Um, that's it for this video. I just wanted to give a quick update. I think this video went on a little bit too long than I was expecting it to go. Well, not really. It's 15 minutes, which is not bad compared to all the other videos I've been putting out. But I'll give more updates as they come in. Please look at all my videos. I'll have links down in the descriptions to where you could go to directly to those. Please leave a like. Just give this video a thumbs up if you like the video. Share, subscribe, and hit that bell icon. And of course, I want you to, as I mentioned, leave your comments. I want to hear your feedback on what you think about this. Until next time, this is Drew with Let's Talk Something. See you guys on the next video.